pag-usapan natin about ulcer, gastric cancer, and colon cancer. I will reintroduce our guest, katabi ni Liza, ang past president ng Philippine Society of Gastroenterology, past president, Philippine Society of Digestive Endoscopy, current president of the Philippine College of Physicians, Dr. Ben Gloria. Katabi ko naman, current president of the Philippine Society of Colon and Rectal Surgery, Dr. Ramon Estrada. Okay? Maganda pinag-usapan natin. Ang dami ng questions.
So, Willie, marami ng callers, no? From Nap Cortel of Malate, Manila, kailangan bang every year magpa-ultrasound para ma-detect ang early signs ng mga cancer sa tiyan?
Well, ang cancer sa tiyan, sa mga kagaya ng sa stomach, hindi na-detect yan ng ultrasound. Ultrasound is good for the solid organs and it is also good for the gallbladder. So, ibig sabihin, yung mga bato sa gallbladder na-detect yan, yung sa kidneys, nakikita yan, but yung sa mga bituka, the ultrasound is not a good tool.
So, solid organs lang, sir?
Normally, yes.
So, pag cancer, kailangan is ibang test.
Can I add something?
Sir.
Again, usually pagka napunta sa amin na may pain sa upper portion, if you will notice, if I have some patients in the audience, usually we go for gastroscopy and ultrasound. Yung nakikita kasi sa gastroscopy, hindi nakikita sa ultrasound. At yung nakikita sa ultrasound, hindi nakikita sa gastroscopy. So looking for cancer, depende kung cancer saan ang iyong hinahanap. Ano? And again, hindi kailangan magpa-ultrasound every year just in case naghahanap ka ng cancer, depende sa nararamdaman ng pasyente.
Apo. So, from Sharina Valero of Makati, so, nasagot na to kanina. Sharina, ano bang sintomas ng ulcer at paano malalaman ng hyperacidity? From Eddie Menoy of Quezon City, sa may right side po ng tiyan ko, parang may pumipintig-pintig at pag dumudumi ako ay may hangin sa pagitan. Ano po ba ito? Colic po or appendicitis? Dr. Estrada.
Ang appendicitis, right-sided pain yan, severe right-sided pain, na hindi nawawala. At ito'y kailangan gamutin kaagad by doing an appendectomy o kailangan ng operasyon. Now, yung papintig-pintig na pabihira-bihira, usually is just kapag or hangin. Colic lang yan. Pwedeng colic sa ating daanan ng ihi or daanan yung ating extra na hangin sa ating bituka.
Apo. From Arnel Galang, kung palaging kumakain ng spicy food, masama po ba ito para sa aking tiyan?
Again, napakadami ang mahilig sa spicy foods na wala namang nararamdaman. Kung nakain ka at may nararamdaman ka, siguro kung hindi mo man ititigil, gawin mong moderation, bawasan mo. But spicy food per se is not really that bad sa stomach. Ang sabi nila, spicy food is bad sa almoranas.
Siguro lipat naman tayo sa gastric cancer. Ano bang mga latest ngayon sa gastric cancer, Dr. Estrada?
Well, kung titignan mo yung statistics ng gastric cancer, it has gone down. Ang mas madalas na cancer ngayon is colon cancer.
Pero ano bang cause ng gastric cancer?
Well, up to now, we do not know yung cause ng gastric cancer. And usually, pag nagkakaroon ng gastric cancer, we normally detect it very late.
Kaya nga Tsaka sabi nila sa mga Japanese, very high in gastric cancer. Tama ba yan?
Well, the Japanese, high in gastric cancer because they do endoscopy every birthday. So,
every birthday nila?
Yes.
Bakit kaya?
So, ang Japanese are prone or they have the highest rates of gastric cancer
in the world.
In the world, and they also have the earliest detection of gastric cancer and the best cure of gastric cancer. Bakit nangyayari to is above 40, once it is their birthday, they are requested to undergo an endoscopy.
Every year?
Every year yan. Kaya very
Free
small.
ba yan? Libre?
Libre yan ng Japanese government.
Sana magawa natin dito, no? Sir, about gastric cancer?
Gastric cancer, as mentioned by Bats, it was noted to be very high in Japan. And they don't know why, but it's being associated with high intake of nitrogenous product.
What's nitrogen?
And nitrogenous product na note sa Japan, the one containing nitrogen, was associated with the regular diet of the Japanese.
Like
which is
what,
not
sir?
sashimi or sushi.
Ano is
That's for the
Smoked
rich.
food.
The one is pickles.
Pickles?
Pickles.
Masama kumain ng pickle?
So, I mean, it's the association that was noted. But just like any association, it's not proven 100%.
So-
Now, because of the high incidence of gastric CA in Japan, then the government had made it a policy that is just proper, that screening should be done. That's why ginawang policy ng government ang regular endoscopy for early detection of gastric CA.
Sa Philippines?
The incidence of gastric CA in the Philippines is not as high in Japan. Ano?
Worldwide, the incidence has gone down. Right now, what has gone up is colon cancer. It is colorectal cancer that is going and creeping up as going up the ladder of the number one cause of cancer.
Willie, can I add something?
Yeah.
The other thing associated with gastric CA, as mentioned by Bats earlier when we were discussing, is genetics. Genetics is a factor.
Anong type na naman to, sir?
And the
Anong
other
blood type
thing,
na naman?
A pa din.
Blood type
Sir,
A.
how about
And the other
processed
thing
foods?
is H. pylori.
H.
H.
pylori.
pylori is associated with gastric cancer, especially what you call malt lymphoma. Ano? A form of gastric cancer,
Okay, ulit,
ano?
sir.
Lymphoma,
Lymphoma.
malt lymphoma. Ano? And again, as mentioned by Dr. Estrada, the incidence of gastric CA seems to be on the way down.
Why?
We do not know why. Some are saying just like anything that you do not know. There are so many theories. One of them is probably improving the diet. Ano? And second thing is the eradication of H. pylori.
How do you